Hi everyone, welcome back to Injection Insight with Aaron. I'm Aaron.
I'm Lisa. And today we just have a question and answer episode. So we polled on our Instagram, Facebook, and just
YouTube as well.
Yeah, and some clients that just came in with some questions. So it's kind of a random, you'll get a little bit of everything. The first one, which is something that I know a lot of people talk about and have concerns about. This was an inpatient client that had this question. What is the best treatment for the neck or saggy neck?
That's a fun one. All right, so the neck is an area that one is, people neglect it a lot. So starting off without any treatment base, wear some sunscreen on your neck. Also, skincare is also the neck. Your face is your neck. So bring everything down. So if you're using your retinols, your tretinoins, all of that, bring it down to the neck. Don't neglect the neck. Keys, don't neglect the neck. So that's one, okay? But also, there's many treatments you can do. So whether, if the neck is sagging because you have a recessed chin or you don't have a very strong jawline, treating the jawline, treating the chin, that's gonna help kind of pull everything. If you have a great defined chin and jawline and it's just texture, or it's a little bit of saggy here, we could do PDO threads. PDO threads, what they do is they have these little barbs and they pull and tug the neck. So those are great ones. So that would kind of pull it. An alternative to that, you could do microneedling. You know how I feel about microneedling on the neck, and that's going to help stimulate collagen. It's going to help, help with the texture and just firm up that skin. You can also do a Nefertiti neck lift, which if you're unfamiliar with, is basically it's units of Botox or any other neurotoxins, Xeomin, Dysport, Daxxify, all those little fun ones. But basically treating the platysmal bands, which are the muscles on the neck that pull down. So it basically helps paralyze those areas and lift. So it's a nice little, they call it like it's basically just, it's the easiest way to treat it without doing fillers.
Yeah. There's a lot of different options.
There's a lot of options.
And then also just one other thing is Kybella, right? Kybella. So if you have a little fat pad too that you just can't get rid of.
Well, that one, so with the Kybella, it's great because it basically dissolves and gets rid of the fat. But it just, the proper assessment for that, making sure that it's not, it's not fat, it's fat and it's not sagging skin. So just making sure that you're doing the right treatment, but that goes along with your consultation, right? So making sure that you're consulting prior and knowing that it's not going to be 100% resolved the first time. Having that proper treatment plan, coming up with it together with either me, your injector, or if you're out of the country or state, doing it with your injector, making sure that you come up with a proper plan. Because as you're doing it, you might not notice right away because you see it every day. But if you look at an image from one day and a year later, you've been doing these treatments and all of these things, look at your skin a year later, you will notice a big difference. Making sure you do a before and after photo so you can really compare, you'll notice it is a drastic difference. People don't tend to notice that because it's sometimes so subtle as it's happening.
There's a lot of options. That's good.
And just, sorry to cut you off, but making sure that, wherever you're at, just get that consultation. So reach out and we'll consult prior to find out what the best treatment plan is for the neck.
Okay, perfect. So we had another one. This is Amber. This was from Instagram.
Hi, Amber.
What are the latest trends that are coming up?
All right, so the latest trends. Wow. So I mean, honestly, there's so many different trends going on. I don't know if you've seen the beef tallow recently.
No.
You haven't seen the. This is it's all over social media. So it's instead of using medical grade skincare and professional products, people are getting fat, beef fat.
Okay.
It's called beef tallow, and they're putting it on their skin. Yes,
this is new to me.
That's a big trend. I'm not about it personally, but some people swear by it. But just make sure you do your research before you follow a trend like that.
And a lot of times they're posting that stuff too just because they want to go viral.
They want clout.
So
they want clout, So just making sure,
Okay. Another question that was through Facebook, actually. How many units of Botox will I need? So
So
it's such a huge question.
that's a very, very vague question because
It depends on the area.
if you've been to me or you've listened to my podcast, you'll know that I am not a one size fits all injector. You will not have the same units for Stacy, Becky, Steve, Samantha. You will not all get the same injections. I will customize that treatment plan for every person when we do our consultation. So, say for instance, you have, you want to treat your forehead and your glabella, which is the inner part of the brow, or your crow's feet. But then Stacy wants to treat her neck. She wants to treat that platysmal band that's pulling down, which goes back to that neck question we discussed earlier. So just making sure it can range. Honestly, it can be anywhere from, I don't know, 20 units, 10 units, all the way up to 100. It varies per person. It's a very hard question to answer because, like I said, I will tailor every treatment to each person.
So just like the forehead area, though, what is the most common, I guess, kind of amount that somebody would expect?
So, for instance, if we're going off of, like, say, Allergan's recommended dosing would be 64 units.
Just for the forehead?
Just for so basically it would be the 4 areas. So 64 units is their recommended dose, which would be 20 units in between the brow, 20 units on the forehead, 12 units, and 12 units. And that's theirs. But like I said, I tailor it. Because, for instance, yes, so if somebody has a small forehead and, they don't even have space for that amount of units, I wouldn't inject that just because the box said 20. I would go less.
Yeah.
I would go 10. I would go 15. I wouldn't necessarily do it because it says it on a recommended dose.
So there's not like a typical just whatever
No,
amount.
I mean, on average, I would say, if I had to say on average, if we're treating the 4 areas in the upper part of their face, it ranges anywhere from 40 to 64 units. Yeah. It does. It ranges.
And I would say, too, just in something that's important, and when you're going somewhere and you're getting, a consultation and somebody's saying, well, I think you need this many units, I think it's good to ask questions.
Why?
Like,
why do you think
what
I need
does
that?
this do for me? What will it? So, yeah.
So let me just say as well. So if you go to a med spa or doctor's office, surgical center, whatever it may be, and you're doing your consultation and they jump straight to the highest number of neurotoxin, in my personal and professional opinion, that's a red flag.
Yeah.
Because there is a cost associated with these
per unit.
Yeah, per unit, right? So if they're on the higher end and they're jumping to the highest number, or if they're giving a crazy discount and they're jumping to the highest number, these are things that you want to be aware of.
Yeah.
Right? So just making sure that they're quoting you the dosing based off of what you need and not based off of what they want in their bank. So.
And the flip side to that too, I just want to throw out there is we all love a good deal, but some of these places are offering Botox and some of these neurotoxins very cheap. Yes. And you just want to be aware that you're actually getting the product, the real product. Yeah.
So with that, I'm going to kind of spiral into another area and just, basically making sure that they're using the appropriate, so not every, like Kleenex, for instance, not every Botox is Botox. Yeah. So if your units are at like an insanely low number, yes, you might want that deal, but one, is it the actual brand, or are they using it as a blanket term, right? A blanket name. So you want to know what the actual neurotoxin is, whether it's Xeomin, Dysport, Botox, Daxxify, whatever the brand is, making sure that you know, because they do all yield similar results, but they're not all made the same, right? Some have peptides, some have, they're cleaners, some have proteins. So you want to know these things. And then making sure that they're drawing up their product in front of you. And the thing is, if they are doing that and they're, you want to ask those questions, especially if they're being evasive, right? So if they come in with needles that are pre-sent, oh, here's your Botox. Well, why didn't you draw that up in front of me?
Yeah.
Where's the bottle, right? So with that being said, you can also look online. There is guidelines to know whether the bottle is an actual Allergan brand bottle, or you can always call us or reach out to us. Our number's in the bio, and we can give you the guidelines of what to look for to making sure that it's an actual Allergan brand and not a knockoff that is shipped in from overseas.
Yeah, because sometimes too, I mean, we've had patients come in and they say that they got it done somewhere else and then it just didn't last long. So
Oh,
you
that's
don't know
the number
too
one to
if
hear.
it's
It lasted
watered
two
down.
weeks. It lasted a month. Well, neurotoxins is supposed to be lasting anywhere from 3 to 4 months. Yes, you can have some, some fluctuation, whether it's your diet, your workout, your medication, whatever that may be. Fine, it might go down a little bit, it might go up a little bit, whatever. But 2 weeks, a month, that's not normal. And people like to quote that they are immune. Are they immune, or did they get appropriate product?
Yeah,
That's always my
true.
question. So.
Yeah, just know where you're getting things, do your
of course.
research. Okay, so the next one would be, what can I expect during consultation and treatment? I know we kind of touched on this before at one of our other episodes, but maybe just, here in our office, what to expect. And then if you're not in this area, what to, ask and look for when you're looking for a med spa.
So a lot of times people tend to come in wanting a procedure, but they don't really, like you said, ask the appropriate questions. So during our consultation here at Derma Beauty in Calabasas, we're going to ask all the appropriate questions. We're going to ask what you want it treated, what your goals are. We're going to ask you all your medical questions, get you medically cleared with your good faith exam, and just basically getting the background in addition to what you want to treat. And then we come up with that plan for you.
Yeah, just know when you're coming into, you're going to have paperwork to fill out.
And that's normal.
You're
going to
have,
office,
yeah,
right?
You're going to have the good faith. We will take before and after pictures, and it's just for your chart. So these are all important things.
But also the client should be asking, like, okay, they come in, I want my lips. If you go somewhere and like, okay, sure, and they inject you, what product was put in my lips? How much product was put in my lips? Keeping track and making sure that the med spa or the office that you're going to has a clear record of what's being done. So if you decide, hey, I don't like this, what was it? They know, and they could tell you, right? And not be evasive, because why are they being evasive? Why are they not telling you? You need to know these things. It's your right as a patient in a medical office to know these facts.
Yeah, and it's your body, so you want to know what's going on.
Just like, you go to a medical office and you get yourself a vaccine or whatever you do, you know what you're getting, right? And you also have the right to ask what's in it, similar to what you'd be asking here. So it's important.
That's good. There is another one here from Instagram. What are some of the cost and finance options that we have? And we can answer, obviously, what we can provide here, but...
So with this, we have an array of products, right? We have an array of products. We have an array of ranges from low end cost to high end cost, depending on what it is that they're trying to treat and what areas and what products are being used. But basically, we have we have obviously credit, cash, all that stuff. But actual financing, we do care credit and we do cherry. And basically that gives the client the freedom to basically pay over 6 months, 12 months, 2 years, whatever it is, whatever they get financed for. So it gives people a little bit more freedom, a little bit more comfort in that.
Yeah, because a lot of the procedures, they are a little more costly, or they can add up. So, you could just feel comfortable that you do have options for that.
And with that being said, my goal is to never make you feel uncomfortable or make you feel like, nervous because you can't afford it. So I would prefer to do a full-on consultation with you, come up with a treatment plan, and then have you come back when you're financially ready, and that is okay. I'm 100% fine with that. Come back when you're ready, when you feel it's financially okay, versus doing something and now you're stressed financially for the next 12 months. I would never want that on anybody.
Yeah.
And the thing is a lot of what we do, right? We come up with a plan, we come up with those treatment goals, and these things take time. So, you have the time to come up with the money financially or have that plan to do it. It doesn't all have to be paid for right away.
Yeah.
So
you have many options.
There's many financial options, absolutely.
Okay, that's great. Great. So one other final question. If somebody is preparing for a big event, say a wedding, a trip, something like that, how much time should they allot to prepare for this? I know that does depend on what treatment they're getting, but just kind of knowing. So if they're wanting to do something like threads, you want to give that a good month or so before the big event.
Yeah, absolutely. I think that first of all, please let your injectors know. Don't ask for a procedure, get it done, and then tell us. please tell us in advance so we know to stop and say, you know what, let's hold off, because we don't want you going to that wedding with a black eye, right? Or a bruise or a swelling in your lips, whatever it may be. We don't want that either. It's not a good look for us, as it's not a good look for you. So basically, I mean, dermal fillers, I mean, you want to give it a couple weeks. Any kind of threads, you want to give about a month. But just basically giving yourself that anywhere from like a few weeks to a month before a procedure. And then same thing with your neurotoxin. So, you know, sometimes it can happen with any treatment, but with neurotoxins, you can get like a little spiky brow or whatever, maybe little tweaks you might need here or there, which everybody's muscles react slightly differently. Just giving yourself at least 2 weeks before an event with neurotoxin. So if you need a touch up or you need something adjusted, you can come back and do it before that event.
Okay. And then I would just suggest too, if it's a wedding or an event that you just want a nice little glow, I think microneedling would be an amazing option for your skin. And you could do that, you know, a week before. And I think it would just give your skin a nice photo finish.
Exactly. Yeah. And don't forget a facial. Pamper yourself too, not just needles.
That's true. We have relaxing stuff too.
Exactly.
All right. And so our code this week is skincare20, and that's going to get you 20% off of any of our skincare products.
Yeah. And then just make sure that you follow our YouTube channel, our Instagram. We have Facebook as well. And if you want to schedule a free consultation with us, just make sure that you click the link below, and that'll get you that consultation. We also do virtual consultations if you're not in the area.
Perfect. And we'll see you guys next week. Thanks for listening.